Most people think an MRI will tell them exactly why their back hurts. I thought the same thing when I injured my back and I was dealing with crippling pain, being unable to walk. So for me, I remember wanting an MRI to essentially figure out what was wrong with my back. And I think a lot of you who have done an MRI or want to get an MRI can actually relate. We're in pain and we want to figure out why we're in pain. So we think that getting an imaging is reassuring. Honestly, I can't blame you because I've been there myself. So I got my MRI, I looked at it, I spoke to the doctors, I was like, wait a minute, my left hip seems to be tilted, my left erector muscle seems to be way more hypertrophied, so more muscle mass than the right, and I have pain on my left side. I wonder if there's a correlation or causation. Now, mind you, I wasn't sure, but the option of getting a surgery didn't feel appropriate for what I had been given. My gut feeling told me to explore other suggestions, or well, honestly, initially it was kind of just this depression of not knowing what to do and not having a proper solution to it. But more on that in another video. So an MRI is a great diagnostic tool because it shows a lot. So it can show, like the thumbnail of this video, my disc herniation. It can also show spinal stenosis, for example, when you have growth in the spine, and it can also show fractures, bone spurs, heck, even tumors. I remember this one time when I was at a seminar with Dr. Stuart McGill, world-renowned back clinician, that it was like the patient had a tumor, and if he hadn't come to a back clinic, he would have died by now, cancer. So they were able to remove the tumor, and he was fine afterwards. You can see infections and the anatomy of the spine. So that's exactly what it's designed to do. But how do I put it? Like, I don't want to talk shit about an MRI because on one hand it's very reassuring, on another it can become this doomsday prophecy where, all right, this is what I have, now this is what I need to deal with. But an MRI can't really explain why your pain increases at the bottom of a squat, for example. It can't really explain why walking helps. It can't necessarily explain what exercises you need to do, what hurts and what doesn't hurt, and how to, for example, progress your rehab. Like, I've helped a couple dozen people with their backs come back. Haha. I'm by no means an expert yet, but what has worked for me and my clients is to thoroughly assess. And an MRI in certain cases has been part of the assessment that we've used. But on the other hand, I've had clients, where their MRI was perfectly fine, but they were in pain when moving anyways. So it can't really tell you how your symptoms change over time either. So to sum it up, like, an MRI tells me what your back looks like, to a radiologist as well. An assessment, on the other hand, tells me how your back behaves. And you kind of need both pieces to make better decisions, better informed decisions for your back. So for example, if you're flexion intolerant, like I've covered in another video, then it might not show on an MRI, but a movement assessment will determine that and determine what to avoid in your case. Yeah. So hopefully that leaves you brighter off than before.